Yeah. And I think so I kind of fell down a rabbit hole prepping for this episode. And I was like, I wonder how many clinics and centers. So oftentimes I think clinics and centers are kind of now used
Intertwined, right?
interchangeably.
Yeah.
Yeah, but some clinical settings, I think when I first started in ABA, a clinical setting more meant treatment for severe problem behavior, feeding issues, um, you know, spaces. They weren't as common. And I think now that insurance mandates cover ABA coverage for autism,
Hmm.
there's centers everywhere
Yeah.
to treat autism. And so they do tend to be not necessarily these like intensive outpatient spaces that you see in other, like addiction or,
Hmm.
injury where you're getting this like intensive therapy for short periods of time. I think a clinical setting in ABA can be a center-based setting where it's a highly controlled ABA space where they've designed it to be a specific, with environmental modifications to look a specific way, to reduce the likelihood of problem behavior, to increase the likelihood of language, verbal behavior. And they tend to be, I would say, most, at least in New Jersey
Hmm.
and New York, I would say also, they tend to be up to preschool age, like 5, 6-ish, because
Yeah.
it gets a lot harder to provide intensive ABA to older ages through like the school regulations. Like there's just so many more rules on what you're allowed to provide for kids as they get older. I mean, there's certainly centers that provide after school center-based therapy, but I think home-based tends to be more common as kids get older.
Yeah, and especially as they age out, right? Like we usually get them when they age out at birth to 3. So the family
Mm-hmm.
can decide if they want to, because once a child has a diagnosis and they hit the age 3, they go to the school district